How much honey should you be eating daily? The incredibly sweet taste of honey brings joy to the face when it's eaten, but it also breeds fear in the heart. And that's the fear of consuming excess sugar. But should you really be worried? Well, in this video, we'll examine the scientifically confirmed health benefits of honey and examine how much honey you should be eating. Then we'll answer the question, can eating excess honey regularly affect your health negatively? But first, have you subscribed to Nutritioner yet? We help you make the right decision about what to eat and how to eat for good health by sharing scientifically accurate food tips and facts. Kindly subscribe now and turn on the notification bell so you will know whenever we upload a new video. And remember to drop us a like. Okay, let's get back. For centuries now, honey has been used as a natural medicine against several health conditions. And today, honey is still used by many as a therapeutic agent. But is honey really an effective medicine? And what conditions can be treated with honey? Let's go over the scientifically confirmed health benefits of honey. 1. It aids faster healing of wounds. Recent experimental research has confirmed the ability of honey to facilitate healing of wounds. And this is due to its antibacterial, antiviral, anti-inflammatory, and antioxidant properties. When you apply honey onto a fresh wound, it stimulates the release of chemicals known as cytokines, which kickstarts the process of repairing the damaged tissue. The honey also activates the immune response so that it can fight off infection. Several evidence supports the use of honey in the treatment and control of acute wounds, mild burns, moderate burns, and leg ulcers. But for severe wounds, it's best to meet a doctor first and have it examined. 2. Improves cardiovascular health. Research studies have shown that honey can be good for the heart as it controls the risk factors that can cause heart problems such as blood lipid profile. This positive effect of honey has been observed in lab studies, animal studies, and even clinical trials. And they've been noted both in healthy individuals and those with health conditions. So, if you're battling high blood pressure, you can be sure that eating honey will provide an added advantage in keeping the condition in check. 3. Treatment of cough. We all know how annoying cough can be, right? It's one of the most common complaints that people bring to their doctors. And it's especially common in children. But do you know that people treat cough with honey? Well, scientific evidence also confirms that honey is effective at treating cough, although not all types of cough. In one study, honey was found to be more effective in reducing cough frequency than other treatments. And this is also true in the case of children between the ages of 1 and 5. However, you should avoid giving honey to children below the age of 1. And we'll explain the reason for that later in this video, so watch till the end. 4. It boosts the immune system. According to research, honey has been found to activate immune cells to produce cytokines, which helps to fight infection. The high acidity and osmolarity of honey also creates an environment that's hostile to microbial growth, thereby making it a potent antimicrobial against several microorganisms. Honey has also been found to provide glucose and energy to macrophages, which are cells that eliminate other infected cells and tissues. 5. Managing gastrointestinal diseases. The benefits of honey for the digestive system has been studied in various medical conditions such as gum diseases, stomach discomfort, and dehydration. Some laboratory experiments suggest that honey can kill harmful bacteria such as Helicobacter pylori, which causes stomach ulcers. However, a clinical trial that tested Manuka honey's effects on eradicating Helicobacter pylori did not show any beneficial results. Nevertheless, this can be a sign that different types of honey confer different health benefits, and the benefit might also be different for different individuals. But honey can be a helpful part of oral dehydration therapy, as it's been shown to reduce the duration of diarrhea in infants and children who were hospitalized with gastroenteritis. 6. Supports management of diabetes. Can you actually believe this? That despite its sweet taste, honey could still have beneficial effects when it comes to treating diabetes. Well, that's the truth. Studies suggest that honey may be used alongside standard anti-diabetic drugs to help control blood sugar levels. Although there are still questions that need to be answered around that, such as how much honey should people with diabetes take and for how long? But what's clear from the research is that honey may have potential in controlling blood sugar level and improving associated metabolic complications. Aside the benefits we've just mentioned, Other benefits have been associated with honey due to some of its inherent properties. However, there's need for further research to confirm those benefits and how to use honey in such cases. An example is the use of honey in the treatment of cancer due to its anti-inflammatory, apoptotic, and immunomodulatory activities. Another example is the use of honey in neurological diseases, as it's been shown to offer antidepressants, anticonvulsants, and anti-anxiety benefits while also helping to prevent memory disorders. Now, as beautiful as honey is, both in taste and medicinal properties, it's important to ask the question, does honey have any negative impact on the health? And the answer is yes. But wait, I'll explain. You see, honey is sweet, and that means honey has high sugar content, right? And that means that eating large quantities of honey consistently over a long period can have damaging effects that are similar to those of pure sugar. And this include weight gain and increased risk of diseases such as type 2 diabetes or heart disease. But the key words here are excess and over a long period. So to be on the safer side, it could be best to stick with the advice of American Heart Association, which recommends no more than 6 teaspoons for children and women and no more than 9 teaspoons for men. However, there are other concerns with eating honey, either in moderation or in excess, and this includes 1. Allergies. Some people actually have allergic reactions when they consume honey, and it doesn't matter if they take much of it or little. This is because their body is sensitive to specific components of honey, especially the bee pollen. And although it's rare, the symptoms can sometimes be fatal, and they may include skin rash, nausea, vomiting, and even fainting. So if you notice any reaction after consuming honey, make sure you speak with your doctor before trying it again. 2. Diarrhea. Although evidence suggests that honey might help relieve gastrointestinal tract conditions like diarrhea, but when you take excess of it in a single sitting, it might also cause bloating or diarrhea. In theory, this is because honey contains a higher level of fructose than glucose, which may lead to incomplete fructose absorption and cause diarrhea. 3. Adulteration. As the use of honey has increased in recent years, so has the level of adulteration. Honey is a natural food, and its health benefits are tied to it being natural. So, consuming adulterated honey, especially for a long time, can nullify the health benefits of honey and lead to conditions such as increased blood sugar, which can cause diabetes, abdominal weight gain and obesity, and it can also cause high blood pressure. So you should be wary of buying and consuming adulterated honey. Instead, buy from trusted sources. 4. Infant botulism. Previously, I mentioned that you shouldn't give honey to children below the age of 1. This isn't because honey is ineffective for them. It's because sometimes honey contains the spore of a certain bacteria that can produce toxins in the baby's intestine, which can lead to a very serious illness known as infant botulism. In adults and children above the age of 1, as they only pass through the digestive tract, the spores are equally digested and destroyed. But in children below the ages of 12 months, the digestive system is not well developed enough, so they are more susceptible to the toxin. Therefore, it's best to avoid giving honey to children before the age of 1. In summary, we've listed 6 scientifically confirmed health benefits of honey and 4 reasons why you might want to avoid using it. With this in mind and consuming honey in moderation, you can enjoy its sweet taste and reap its many health benefits. Thanks for watching. I hope you enjoyed this video. If yes, then give this video a like and share with others so they will enjoy it too. And be sure to watch other videos on our channel to learn more about how your foods can help you get healthier.